G'day, mates. Welcome to MindTune. This is Chloe. We are together, falling in love with our true selves.
Trypophobia is a fear of closely packed patterns or repetitive shapes, often causing intense discomfort or anxiety. It can lead to physical symptoms like sweating, rapid heartbeat, and even panic. In extreme cases, it can interfere with everyday life and work. Why do some people feel intense fear toward these patterns? While there's no clear answer, many studies suggest that trypophobia is linked to how the brain processes visual information and our survival instincts. From a psychological point of view, trypophobia happens because our brains are sensitive to unnatural patterns. The brain becomes overly alert to repetitive or tightly packed shapes, especially when they have strange or irregular details. This heightened awareness may be part of our survival instinct, where the brain links dense patterns to potential threats, like beehives or poisonous substances. In ancient times, staying alert to these types of patterns was crucial for survival. However, many of these patterns in modern society aren't actually dangerous, but the brain's natural reaction still triggers anxiety and fear. Trypophobia symptoms can differ greatly from person to person, ranging from mild discomfort to intense fear responses. Common symptoms include visual discomfort, dizziness, nausea, rapid heartbeat, and in some cases, even panic attacks. When exposed to patterns like holes in leaves, beehives, or small bumps on skin, people with trypophobia often experience a strong sense of unease and anxiety. This can go beyond just visual discomfort, leading to psychological issues such as increased anxiety, depression, or avoidance behaviors. For example, in American Horror Story, Cult, Season 7, the character Ally, played by Sarah Paulson, is a classic example of a trypophobic person. She experiences extreme anxiety when she encounters objects like a coral sculpture covered in tiny holes, or even in everyday situations like seeing products with hole patterns in the supermarket or when surrounded by crowds. This phobia severely impacts her daily life, leaving her in a constant state of anxiety and fear, and it negatively affects her relationships with family and friends. Given the significant emotional and mental toll this condition can take, it's important to explore effective treatment options. Here are 3 common therapeutic approaches for treating trypophobia. The first method is systematic desensitization, which involves creating a fear hierarchy. This list ranks fear-inducing situations or objects from least to most frightening. The patient starts by facing the least fearful stimulus while in a relaxed state and gradually works up to more intense triggers. By repeatedly confronting these triggers in a controlled, relaxed environment, the patient's fear response weakens over time, helping them tolerate even the most frightening situations without becoming overwhelmed. The second method is virtual reality exposure therapy, which uses VR technology to create immersive, intense scenes. Patients are exposed to these virtual environments in a safe and controlled setting where the intensity and duration of the fear-inducing stimuli can be adjusted precisely. This allows patients to gradually face their fears at a comfortable pace, helping them become less anxious and more capable of dealing with their phobia in real life. The last method is group therapy, where patients form small groups to share experiences and coping strategies, offering mutual support. This interaction helps them learn new ways to handle fear, boost social skills, and reduce social anxiety caused by the phobia. If psychological therapy doesn't work, alternative treatments can be considered. One of the most common methods is deep breathing and meditation. Deep breathing helps patients relax by sitting or lying down, closing their eyes, and breathing in slowly through the nose, letting their belly expand, then exhaling slowly through the mouth. Progressive muscle relaxation starts from the feet, where the patient tenses muscles for a few seconds, then releases, feeling the difference between tension and relaxation, helping the whole body relax. Meditation and mindfulness training are effective in reducing anxiety. In meditation, patients focus on their breath or a specific image, gently redirecting their attention back when their mind wanders. Mindfulness training encourages patients to observe their emotions and physical reactions in a non-judgmental way, helping them learn to accept and coexist with their fear. Although trypophobia can be a distressing condition, it is not an insurmountable one. By understanding the underlying causes of the fear, accepting our emotional responses, and implementing effective coping techniques, we can gradually reduce and even overcome the fear. It's important to stay patient and maintain a positive attitude throughout this process.
Subscribe to the channel and click the bell for updates on the latest content and psychology insights. Thanks for watching and stay tuned. See ya!